Good evening. My dear friend Marta Goldblatt is here, and I single you out because Marta and I were classmates in middle school. So just a few years ago. Marta, who would have told us we'd be here today? So from one immigrant to another, you know what this is about. On behalf of the 9 Welcome Back Centers and of the thousands of people we serve, I want to thank first the Kaplan Fund and the Migration Policy Institute for this honor. And I want to take a moment to recognize my colleagues from the 5 Welcome Back Centers that are able to be here today. And Chris Mason from Washington State, Sonia Mora and Carmen Sáenz from the center in Maryland, Manuela Raposo from the center in Rhode Island in Providence, and Doram from the center in San Diego, and last but not least, Susan Downs-Karkos from the center in Colorado in Denver. As we were starting the Welcome Back project, the first question we were asked was, how many people are you going to serve? And even though we didn't have an answer at all, not even a guess of what we were talking about, everybody we spoke with could relate to a story of the taxi driver that had been a doctor in Mexico, the dentist from the Philippines that was working as a babysitter, the nurse from El Salvador that was working as a maid in a hotel downtown. But still the hard data on who these folks were, what they needed, what were the challenges they were facing, what were the services that could help them was nowhere to be found. And sadly, this had not even been given much thought. In the 10 years since we started the work of the Welcome Back Initiative, we have identified over 11,000 people from 151 countries. Identified. These individuals are primarily physicians, nurses, dentists, pharmacists, social workers, physical therapists, rad techs, psychologists, you name it. And 72% of them are women. They have on average 2 dependents, and their income at intake is around $18,000. And even though 90% or more of them have at least 1, if not 2 jobs, a full 66% of them were not employed in health at all. And those who were employed in health are employed well below their level of training. We're talking about physicians working as medical assistants, nurses working as nursing assistants, and things like that. Approximately 7,000 of these 11,000 people have actively engaged in our services. On average, they spend about 18 months with us, and at the end of those 18 months, their average income grows by about 218% to over $40,000. So let's take a collective moment to think. What does this mean? What does this mean for the tax base of communities? What does this mean in terms of the opportunities that families have to afford better housing, to afford better education for their children, to afford to make remittances to their countries? There's so many incredibly positive outcomes of this investment that, I don't know, I don't think I need to say any more about that. But to date, over 2,000 of our participants have either achieved their professional goals and have returned to their health workforce for the first time, or have been able to move up from those entry-level jobs in health, from drawing blood into actually doing some kind of patient care. Almost 100 physicians have re-entered the residency training program and are on their way to providing services in primary care settings overall. Thousands more are currently in the process of achieving licensure or the certifications they would need that will enable them to return to the health workforce. All of them bring along not only the wealth of their experience, but the gifts of cultural and linguistic diversity. And that's no small gift. No matter what they look like, no matter what we look like, what we sound like, or where we come from, we all come and we all share one thread. We all come not looking for handouts, but looking for jobs. And don't forget that. As we embark on what we can only hope will be an intelligent conversation about immigration reform, the case of immigrant health professionals is timely, especially in light of the passage of the Affordable Care Act. In California, for example, A recent study by the California Healthcare Foundation reveals that just over 2 million Californians are newly eligible for Medicaid services. That's just California. Where are we going to find the workforce we will need to provide services to this community? Clearly, the pool of immigrant health professionals who are already in the United States can make a significant contribution to resolving this challenge. I sincerely hope that the work of my colleagues here and all of us at the Welcome Back Initiative will begin to change the perception of immigrants as a social challenge and recognize us as a valuable community asset. Thank you very much.